Welcome to the session about leadership is all about people. This is one of the international sessions that we will have in our value conference, and I'm truly honored to have with me two, I can say, friends that have been working in the Young Executive Leaders program in the last few years from the International Health Federation, and they will share with us some ideas, some experiences from both Canada and the United States of America uh, about leadership and about the importance of people in leadership. So, Taylor, first of all, thank you for being here with us. Taylor Johansson is Director of Neurodevelopmental Health of the Children's Hospital of Eastern Ontario. Taylor serves as the board of Volunteer Ottawa and in the Telfer School of Management Alumni Association. She also holds a Bachelor of Life Sciences and a Master of Health Administration. In 2021, she was one of the Ottawa 40 under 40 and was selected for the Young Executive Leaders Program, where I had the honor to be with her. So for our another guest, Kim Gularte is manager from the Children's Health System of Texas, United States. Kim manages projects in the construction of healthcare compliance and accreditation, clinical operations, and information technology. He also holds a Master of Health Systems Administration and a Bachelor degree in Health Science. Thank you both for being here with us today and for sharing with us your experience. I will pass you the floor. Kim will start. Let us learn a little bit more about leadership. Um, that is all about people. Thank you.
Well, thank you, Leandro, for the great introduction. Thank you to the Association of the Portuguese Hospital Managers for inviting us. We're very excited to share with you our thoughts on healthcare leadership. So, yes, our topic for today is leadership is all about people, and I'm very honored to share the panel with Taylor. So, we really look forward to the discussion and sharing with you all our experiences and how we look to the future with healthcare leadership. So how we want to structure this presentation, there are four main topics that we want to talk about. First, we want to talk about the labor shortage in hospitals, which I think many of you are experiencing all over the world. We would also like to talk about the generation gap between healthcare workers today. Some of our hospitals are also focusing on employee well-being. And finally, we want to close it out with leadership qualities that we believe will make a successful leader in hospital leadership. So first, we want to give you all a background of our healthcare systems because they're very, very different. Again, I am currently located in Dallas, Texas, USA, and as many of you know, the American healthcare system is very complex and it's definitely not perfect. So our healthcare system is provided by many different distinct organizations, ranging from hospitals, hospital systems, there's private practices, there's insurance companies, and it is largely owned by the private sector, not the public sector, like many of the countries all over the world. So as many of you know, we are the only developed country without universal healthcare. But in addition to that, we remain a leader in medical innovation, as proven by our universities and hospitals all over the country.
So I'll take it over here to talk to you a little bit about the Canadian healthcare system. And I am sitting in Ottawa, Canada at the moment. So the Canadian healthcare system is universal coverage. The Canada Health Act is what governs that. But universal in Canada doesn't mean everything. And so really what universally is covered is physicians and nursing, essential services, and hospital care. And so things that are outside of scope for the Canada Health Act are things like dental, eye care, and pharmaceuticals. So if you're very young or very old, then your pharmaceuticals can get covered, but otherwise they aren't. So universal, but not universal. Some provinces in our system will allow a two-tiered system. It's a system where each province gets to govern how they want healthcare to look themselves. And so Canada being a very, very big landmass, we dice it by our provinces, and each province gets transfer money paid from the national tax fund, and then they decide what they want to do on a provincial scale. So some of those provinces might decide, yes, we're going to allow a second tier of healthcare where you can pay out of pocket for things like rehab services and so forth. So historically, Canada is a leader in the universal system. And really, if you ask a Canadian what it means to be Canadian, most people will tell you that, being proud of the universal system is kind of a part of the fabric, a part of the national identity. So that's us. So next, we're going to talk to you about the shortage, the health human resource shortage. I'm sure you're all experiencing it just like we are, both in the States and Canada. So the health human resource shortage is really well documented globally. I'm certain the rest of your sessions will discuss it, so I won't spend a lot of time proving to you that there's a shortage. In 2016, the World Health Organization predicted this. They said 18 million healthcare workers will be short globally by the year 2030. So we've experienced that in both of our countries. And a couple of examples, the USA is projecting that by 2023, there'll be a shortage of about 100,000 physicians and 200,000 nurses. In Canada, a little bit of a snapshot between 2018 and 2019 tells you that our population is growing faster than our population of health professionals. So nurses, as an example, our civic population grew by 1.4%. Nurses only grew by 0.4%. So really, we are outpacing the ability to supply ourselves with health professionals.
And both of our countries are also experiencing difficulty filling vacancies, especially clinical positions. So for example, here in the USA, especially in Texas, we've seen difficulties in filling nurses, medical assistants, also a lot of our techs, so in sterile processing, very competitive and very difficult to fill, especially now. And in Canada, they have particular difficulty in filling nursing, nurse practitioners, psychologists, pediatricians, psychiatrists, and also interesting bilingual positions. So as you know, Canada has English and French as their official language. So it's also difficult positions for those to fill. Speaking of the financial levers in the USA, so like I mentioned earlier, a lot of our healthcare is provided by organization. So the organizations have been implementing lots of strategies to really entice and recruit. So ranging from recruitment bonuses and sign-on bonuses. I think these have really made me consider my career and wanting to go clinical, which I won't. But I think there's been lots of bonuses that organizations have been using to attract talent, especially clinically. Also, internal promotions, we want to keep talent where we are. So in order to do that, lots of organizations have been promoting internally instead of externally. And I've also seen this strategy before where some organizations have given bonuses for longevity and they're using it for retention. So for example, if you stay here for 2 years or 4 years, you will get this amount. And it's really an enticing strategy for clinicians to stay for an X number of years. However, there's also the other side in this strategy is that there's plenty of competition, not just in healthcare, but in other industries as well. So if you are a clinical person, that's very good in terms of that. There's other industries that will fight to have your expertise. We've seen a lot of nurses leave to go to consulting or to government work because they want to break from hospital, especially over the past couple of years with the pandemic. So we've seen a lot of our clinical folks and non-clinical go to non-healthcare, non-hospital jobs. And so just talking about finances, it really benefits a lot of the larger hospitals because there's larger capital and more money in bigger hospitals. And as you can see on the screen, there's lots of news articles about rural hospitals closing, especially small hospitals, because they just cannot compete with bigger hospitals when it comes to staffing and recruiting. And lots of it is really tied to financial levers and money. And so, if you are a nurse who is very experienced, you have a bigger hospital who's offering lots of money compared to a small hospital who doesn't have as much resources, more than likely you will go to a larger hospital. So really, we've seen that competition, not just in the hospitals, but also outside of healthcare.
So one of the things about Canada that is tricky. So in the States, because of the way that the system is designed, you are at liberty of increasing salaries and being able to kind of use your marketing to attract people, and it's competitive. One of the things about Canada in the province that I live, which is Ontario, is that we're actually prohibited from doing that based on legislation. And so, as an example, Bill 124 in the province of Ontario is an act that does not allow hospitals or any organization that is using public funds to increase salaries by very much. So currently it's 1% that you're allowed to give a raise by 1%, but that's the cap. So that we don't have a much of a margin to be able to then say, okay, come and work for our organization because we'll pay you better. It's not permitted. So some of the things that we do though in by using finance is we can give people a referral bonus. So for example, at my hospital, there's an initiative where if you find somebody, you source them and you invite them to come and interview, and if they're successful in obtaining a job here, we'll give that staff kind of like a finder's fee, a little bonus on their paycheck. That thank you very much for helping us recruit into our organization. The other thing we can do is use HR consultants. So we are allowed to, as a business expense, invest in HR firms that are talent finders. And so we do find ourselves using that quite a bit more these days. And we can invest in advertising. So, years ago, I don't think we even had to do any advertising at all. You'd list a job on the website and people would be flooded and you'd have so many applications that you could barely get through them all. Now we're finding ourselves in the reverse situation where we are spending money on advertising in different job boards and other areas that you might find that. So those are the financial levers that we have here.
There's also some geographic levers that affect the current staff shortage. You might have heard in the USA, the nursing travelers program is very popular. I think it peaked over COVID when many hospitals were fighting over nurses. So essentially, a travelers program is that if you are a nurse or not or other clinical staff, you can join a travelers program where you sign a contract for a few months, usually 3 months. You go to a different hospital, usually in a different state. It's contract based and you get paid a lot of money. And so it's one of the contributing factors to the staff shortage because we've had lots of nurses leave to enter the travelers program, especially during COVID. Right now, it's a little less, but yeah, it really contributed to lots of the staff shortage that we faced. And there's also multi-state licensure. So different states entered partnerships with each other. So for example, if I am in Texas now and Texas has a multi-state agreement with Oklahoma, I can easily go to Oklahoma and sign a contract there, work as a nurse for 3 months and come back. So it's very easy for nursing, especially if you are young and you don't have a family or you don't have a house. It's very easy for you to be flexible. It was a very enticing program that really contributed to a lot of the staff shortage in the hospitals. And as you can see on the report by the American Hospital Association, I took a screenshot of it on the right. Again, rural hospital closures that really contributed to patient access, patient care, because now patients have to travel even farther to get the care that they need. Really, the rural hospitals have been closing due to staff shortage. It really affected patient care, and it's a really sad thing to see. But that's another geographic lever that we have seen contribute to staff shortages in the USA.
So Keen mentioned multi-state licensure. So in Canada, we are governed, as I mentioned, provincially, and currently you have to work in the province that you're from. So your license is attached to the province that you work in. Now, depending where you are in Canada, that may or may not matter. So for example, where I live in Ontario, to drive to the nearest province to the west will take me 2.5 days driving. But to drive to the nearest province to the east will take me about 15 minutes. And so, it impacts people or clinicians rather, depending on where they live. There is, however, a lot of interest in this. And so the article that I put here and the website below is about this notion with respect to physicians specifically. So rising attention on, and some lobbying related to changing this practice. It can be done. You can get your license in multiple provinces, but it's hard. You got to jump through some bureaucratic hoops. You got to do some exams in some cases. And the interest right now in Canada is to do a pan-Canadian licensure so that physicians could practice whatever province there are. There aren't that many differences between the way that the province governs healthcare, so I think this could work, and I do think this will happen in Canada.
With all that being said, there is, opportunity for us to evolve as an industry. And, as you've seen in the past couple of years, there's been a rise in virtual care and telehealth to really mitigate all of the geographic factors that prevent people from seeking care, especially if were elderly, if you were young during COVID, if you're a baby, or if you had complex medical care. Telehealth has been really helpful in those situations. There are smartphone applications such as BetterHelp that a lot of Canadians have been using. It is a paid service, but it allows for access to care, and it offers counseling and therapy and other forms of care that could improve access to care. And here in the U.S., we have seen a rise in use of virtual care, especially in rural areas. So again, as I spoke about earlier, when you have to travel far for care, now you can use telehealth or virtual care. And we've seen, some of the innovative ways that telehealth has been part of our system, and hopefully, more so in the future as well. Some of the strategies that both countries have been using to address staff shortages. In the USA, there are programs called nursing fellowship programs, where if you are a nurse and you work in a particular department in the hospitals, for example, you work in the ICU and you want to try something different, instead of you going to a different hospital, some hospitals have been implementing fellowship programs where you can transfer to a different department even without experience. So for 1 or 2 years, these fellowship programs will train you and take you under their wing for 1 or 2 years and make sure that you are prepared and confident. And it's a retention strategy for nurses and other clinical folks to stay in the hospitals. There's also partnership with local colleges and universities. So that really improves the talent pipeline. So, as young as 14 to 18 in high school, hospitals have been partnering with them so that they can start interning and doing externships. And so that as soon as you leave high school or university, you can immediately start working in those hospitals. And it's really, again, addressing the pipeline and ensure that we have the staff that we need for the future.
So some similar initiatives in Canada. We and I work at a teaching hospital as well. So we have always had student placements, short-term things of that nature. However, recently we introduced an extern program because of the shortage in the last year or so. So now my hospital has a program where nursing students in their final year, so they haven't graduated yet, can actually get paid employment at GO. and they are supervised by a fully licensed nurse, and they're working on they're almost there, getting to write their exam, maybe 6 months away. So they have the ability to practice, leading up to that exam. And as soon as they write that exam, they just transition into full-time work at CHEO post-graduation. And so what that does is really just it saves the time of onboarding, because we otherwise may have given them a little bit of a placement and said, okay, call us when you're graduated. But now they worked here for that final 6 months of their degree, and they're here. They know the business and they know the staff, and they just could have blend right into the hospital. So we do that as well. Another kind of lever that is in exploration here in Canada is scope of practice. And so in the public system, we are in a unionized environment. And so scope of practice really is heavily controlled by our unions, but there is appetite to have a look at that. And I think that really is one of the key things that will help us reallocate roles and responsibilities so that we can address this shortage. I think there just aren't enough human bodies, whether they're trained or not, to fill the needs that we need. So we're going to have to think about things like technology and like scope of practice to help us maybe trim down the workflow and see what we can do. So an example to give you today is in pharmacists. So recently in Canada, we introduced some new regulations where pharmacists can now prescribe for minor illnesses. So there's a list of about 10 or so minor illnesses that pharmacists used to need a prescription from a doctor, but now you can just go walk into your pharmacy and pharmacist is allowed to prescribe those. So things like urinary tract infection medication, minor skin conditions, and so forth. And we didn't have that before. Some countries do, but this is new for Canada. So kind of demonstrates some of the direction that we're taking to really rethink scope of practice.
Very exciting.
And about time, really. Like, why do I need a prescription for a bad sunburn? I think pharmacists went to school for a long time, so we trust them too. So the next thing we want to talk about is the generation gap. So we know that we have an aging population. We're in this interesting place where we have those that are closer to retirement grew up in a very different way than those who are now entering the workforce. So we'll spend a few minutes giving you some thoughts on that. So when we think about the generation gap, there's a couple things that come to mind. And the first is the sort of changing expectations of new staff that we find at our hospitals. So in 2021, Forbes wrote an article all about Generation Z, which are those young folks that are now coming on. And what they've said was that Generation Z, unlike other generations, are more apt to leave organizations that have policies that aren't in alignment with their own moral code. So they really care a lot about values, and they're going to think about, does this organization meet the values that I have? And, if you think about the labor market, they now have the luxury of that choice. The same article, which we reference later in the deck, highlights that Gen Z also really likes flexibility and has a bit of an aversion to that kind of conventional 40-hour work week. So I think this is going to challenge us in a way because all of a sudden, we used to hire everybody and come on in and here's what your day will look like. And now the people that are coming up and looking for jobs are sort of, challenging our definition of what the work day should look like. So something to think about. The other thing we think about is the changing abilities of future generations. So not only do they have different expectations, but they actually come with kind of a different skill set than we may have seen in previous generations. So generations Z and also Alpha, if you think about it, like they grew up with technology. They are used to asking computers to solve their problems. A couple of months ago, I asked my HR team, what's the youngest person who works here? Like, tell me about them. And the youngest person who works at my organization is 18. And 18 years ago is when Facebook was created. So think about that for a second. I'm a parent as well. I have 2 children who are both under 5, busy household. And my 2-year-old is already demonstrating that her life, the way that the world that she exists in is different. In my home, I have a number of smart home devices. So I have Google displays and Google speakers, and they control my lights and so forth. And my 2-year-old knows that if you swipe down on a Google display and then you swipe left, you can find a previous video that you watched. And somebody who she really loves Old MacDonald Had a Farm, so she has figured out that if I swipe left enough times, I'll find that video that we watched 2 days ago. And I'll play it again. So just wild to think of that, but yeah, 2 years and 3 months old. At the same time, one of the things that happened in Canada, we, of course, like everywhere else during the pandemic, had backlogs in services because everything was canceled, and then we're getting these wait lists everywhere. So one of the things that Canada had a backlog in was driver's tests. So, you have to go, somebody sits with you and you prove that you know how to drive, and then they say, okay, thank you, here's your driver's license. We had a backlog of those. And so the province that I live in decided, well, how are we going to get through that big mass of people that are waiting? Because of course you pay for that service, and that's time is money. So what they decided to do was to shorten the test. And what they decided to cut from the test was the parallel parking component of it. So you no longer in the province of Ontario have to prove that you can park a car in order to get your driver's license, which honestly, to me, sounded crazy. When I read the headline on this, I was like, oh my gosh, what are we going to do? We're going to have all these new drivers that don't know how to park their car. So they're driving around with nowhere to leave their car. This is crazy. Well, I bought a new car about 2 weeks ago, and it parks itself. So, I guess maybe we're learning that you don't have to do all the things that other people had to do. You just have to know how to ask a computer to do it for you. Who knew? So when you think about the changing expectations of the future generation and then the changing abilities of that future generation, we actually think that gives rise to some opportunity. And we'll turn to that next.
And Taylor, funny you say that because I don't know how to parallel park. So, and I've never had to, so I will definitely fail your driver's test. But now that it's not there anymore, I'll pass it.
Well, you know what's even funnier? I don't know how to make the car do it by itself. I just do it the old-fashioned way. So there you go.
That's so funny. But like Taylor said, these characteristics and the lessons that we learn give rise to opportunity. So when we talk about leadership and people, as leaders, we have to adapt to the changing environments, especially at work, with the new generation coming in. You might have heard the term quiet quitting. Quiet quitting basically means when employees are not as engaged with their companies, they do the bare minimum, and they're kind of in the background, just do their work and leave at the end of the day. Because of the changing expectations, especially for past couple of years, and with the new generation coming in, there's also been a high demand for remote and hybrid work environments, especially if you're not clinical. So as leaders, we have to think, is this something that our organization can implement? Will this attract workers and talent to our organization? I'm currently in a hybrid work environment, and we do a survey every year for our department on to see how everyone's feeling, their satisfaction, their engagements. And it's very high because of hybrid work environments. They can focus more time with their families, and there's clear boundaries between work and personal life. So it's very popular in our department. Again, like Taylor said, adapting to technology, there's been a rise of artificial intelligence, and as leaders, we have to be in touch or keep up to date with industry trends and make sure that when these technologies come in, we can lead our teams to make sure that they work well with our systems. An interesting example, with unisex bathrooms. So, like Taylor alluded to earlier, lots of Generation Zs and younger folks have been interviewed and asked about what their priorities are. And one of them is unisex bathrooms. So again, with Generation Z tying into their own moral code, it's important for them to use unisex bathrooms instead of gender-specific bathrooms. I think, Taylor, you had said that this has been implemented in your organization, as you heard from teens and younger folks. And it's an opportunity for us to evolve as an organization, and in order to attract and retain workers that are from the incoming generation, it's important for us to adapt to that what their moral codes are, to ensure that we attract and retain those talent.
So the next couple slides, I'm going to tell you about actual clinical services that exist at my hospital and that I think are driven by our opportunity to leverage the different generations in our staff complement. And so this first one, what you're looking at now, is a service that we provide. And so I work at a pediatric hospital, and the area that I work in supports children with special needs. Sometimes those children with special needs have difficulty developing social skills. And this program, called Secret Agent Society, is a social skills teaching program. And the way that it's delivered is through a video game. And so it only takes one member of staff as a facilitator to sort of organize themselves around a group of children. And those children are playing this game at home, and they're sort of linking in with the one member of staff who's facilitating them. This is a well-evidenced study. It's a part of a number of universities in Canada. We're affiliated with Carleton University on this, and it does have demonstrated evidence that this does work. It's a little counterintuitive thinking, to develop social skills, you're going to go onto a computer, but this is the reality of the next generation of our pediatric patients. And I think what is to our advantage is that we have young employees who are comfortable and probably use games themselves, able to come in and facilitate that. So that this one's Secret Agent Society, and I've linked it at the presentation as well. Another clinical program that we have that really is supported by that younger generation of employees that are coming in is called YouthNet. So what this is a pediatric suicide prevention program. And so it's for teenagers aged 13 to 20. Again, really well evidenced. And it's a group of evidence that suggests that young people in their teenage years feel more comfortable talking to people who they would consider close peers between 20 and 30 years of age than they would talking to somebody who is over 30. So the bad news is, if you are listening and you are over 30 years old, you're old, according to a teenager. The good news is this program that really pairs younger staff to a group of teenagers and facilitates group activities, it really does work. It does prevent suicide. It does help teenagers overcome mental health challenges. And what we do for this particular program is we have a bona fide job requirement that if you want to work in this area, you must be under 30. And that's how we deliver care. So this is in existence today.
Love it. Next, we will talk about employee wellness and motivation, something that has been top of mind for my organization specifically. So in the United States, it's no secret that our benefits aren't as strong as those in Western Europe and Canada. But I'll talk a little bit more about our organization's benefits to kind of bridge that gap a little bit. I talked about earlier how we do annual staff surveys to ensure that we hear our staff's opinion. They're anonymous, they're confidential, so they can share with us what's working, what's not working. We do annual salary increases to again retain employees. We also started reimbursing our employees for their educational endeavors, so master's degrees in health administration or business administration. We have started to reimburse for that. We also have free employee wellness resources, so ranging from free counseling, free therapy, free financial counseling. Again, just overall improving our benefits to attract talent. Something I thought was super cool was our improved benefits with family planning. As you know, the US doesn't have paid maternal and paternal leave. So we do have that in our organization. And this year they started to have family planning for adoption. So if you want to adopt, you also get maternal and paternal leave, which was never really done before, which I thought was super cool. And one of the things that my organization, a lot of organizations in the United States have been focusing on is diversity, equity, and inclusion. So lots of efforts with attracting talent with underrepresented organizations, because we really do believe that our staff should reflect the patient population that we care for when it comes to cultural competency, and making sure that our staff feel that they are prioritized, cared for, and included in our organization.
So these are some of the initiatives that we have at my hospital around this similar area. I told you earlier, we don't really have the ability to increase salaries a whole lot, but we do have a little bit more latitude when it comes to wellness initiatives and benefits and the packages that you can get that cover your extended health and leaves and stuff like that are quite competitive in the publicly funded system, which is lucky. So at my hospital, we actually have a coordinator, a full-time coordinator whose job is employee wellness here at CHEO. And so she organizes all these things. She's very active on social media. She sends out a newsletter every week, and that newsletter has information about might be healthy cooking. It might be what's going on that week. It could be offering people registration to some free events. There are free fitness classes on site and virtually. There's a walking group if you're located at the main campus. We have a few sites, but if you're at the main one, they meet at lunchtime. They go around the whole campus, and you're part of these sort of fitness challenges and so forth. There's really a kind of a competitive, like who can drink the most water. There's kind of a decoration culture, which I think we find in pediatrics as well. Around the holidays, everyone's decorating their doors, and you win a prize. There are monthly prize draws related to wellness. So you might get a basket that has tea or some goodies in there. We have burnout prevention webinars, dietitian webinars to sort of help people do meal planning, working around their busy healthcare jobs. There's mindfulness and meditation that's free services. And we also have a number of counseling. So there's counseling that comes with your job, that you have an employee assistance program. There's also peer-to-peer counseling. So there's an accredited program here at CHEO called PEEPS, where if you've had a rough time, maybe you've lost a patient, or maybe it was a bad day, an aggressive encounter or something, you can call this number and you reach somebody else who works at our hospital, who works in frontline, who has been certified as a peer supporter, and you can sort of talk it out with that individual. Our hospital has about 4,500 staff, so you may not know the person, but they do work in the same hospital. There's a wellness cart. We walk around during times of surge, handing out snacks to staff, and other sort of, maybe phone chargers and stuff like that. We recently, we've always kind of trying to renegotiate our benefits package with our insurance provider. And recently we were able to negotiate that you no longer need a prescription to claim psychotherapy or massage therapy. So that used to be something, again, you need to go to your doctor and prove that you needed to get counseling, and then it would be covered. You don't have to do that anymore. We also have everyone has an account in this website, Perkopolis, which is a number of retail discounts. So if you go and you're shopping or you're buying tickets to something, you can show your account, and then you might get 10 or 20% off on a whole host of things in the community that are supportive of our hospital. And then finally, we really have a culture of kudos, which is kind of a celebration culture here at CHEO. So the start or the end of any meeting, there'll always be a section where you're throwing a bouquet to someone. Here, I really thought you did a great job in that really tough conversation, and I want to call you out on that. It's really a culture of calling out bright spots and celebrating them. So that does help. That helps.
Very cool. I love that.
One thing we've been doing recently, since we've had quite a surge in the viral season, is we partnered with a college that's nearby that does a certification for massage therapy. And we have massage therapy students practicing on CHEO staff. So they come, you can book a mini massage. It's a 20-minute time slot, and there's a room set aside for it. And you can get a massage therapy student it's kind of a mutually beneficial. They're practicing on you. You're getting a little bit of a massage, on your break, and then away you go. So that's something that we do every Wednesday here. And then the next slide is a picture of what it looks like to be employed at my children's hospital on Halloween. So we're very serious about celebrating, as I mentioned, and having fun. So Halloween's very big in North America, and this is a day that staff are expected to come to work wearing whatever it is that they like for that year. So this is an example of a typical day at Halloween in my hospital.
What were you last Halloween, Taylor? What
I
did you
was a
just?
princess.
Oh, very cool.
Yeah.
And for our last section of our presentation, we want to talk about leadership qualities, and Taylor will share her experience as well. We spoke, a little bit about this, and I was a young manager. The very first time I was a manager, I was 23 years old, and I had a team, and one of them was my dad's age. So it was difficult, obviously, to lead someone who's my dad's age because I'm thinking I can't, tell my dad to do something. So we want to talk about leadership qualities, and I think if we want to talk about leadership, it's all about people. The very first thing is servant leadership. So if you don't know what servant leadership is, it's focusing on putting the needs of your team and your stakeholders first before yourselves. As we talked about, earlier, labor shortage and well-being and the generation gap. It's really important to be flexible and adaptable. There are many times where you can't anticipate what's coming or you feel like it's just a crazy world out there. So it's really important to be flexible and adaptable and really take care of yourself. I think the past, I don't know, 3 years now, there's really been focus on making sure that when you're taking care of others, it's important to take care of yourself as well, whether that's spiritually, mentally, physically, whatever you think would be best for you. It's important to put yourself, first sometimes, but I think you just have to take care of yourself first in order to take care of others. The third bullet point, integrity. It's important to really have integrity, especially in healthcare. Even when no one's looking, you have to do what is right. I think we work a lot with clinicians who take care of our most sickest patients. Taylor and I work in pediatric systems, so it's really devastating some of the things that we see, especially with kids. And then finally, teamwork and collaboration. Again, it ties to servant leadership. It's important to take care of our teams, collaborate with other departments. I heard a quote, it's a quote that I really believe: if we want to go far, or if we want to go fast, do it yourself. Or if you want to go far, do it with others. So really the importance of collaboration and teamwork. And Taylor, if you have any other stories to share or any other qualities, we would love to hear from you. I think this is our last slide. Any lessons learned, Taylor, from your experience?
Yeah, no, I love the quote you shared, and I agree with it. And I think maybe I'd add that, when you're a scientist or a clinician, or you have a different type of currency. So if you're writing papers, the currency that you bring is the knowledge that you put on paper, and you get that published. As an example, when you're in leadership, I think the currency that you have and the value that you bring is all in the relationships that you build. And so the time that you need to invest really is in cultivating those, in seeing the potential in others, in fostering, a group to go in a direction that's mutually beneficial for everybody. And there's really nothing without the relationships that you have. And so, particularly in the caring environment, it is all about feelings. Everybody sort of is drawn to this work because they want to help others, and so you can be a really superb leader if you leverage your own ability to hone your interpersonal skills and focus on that. So that's the way that I feel about leadership.
Yeah, thank you, Taylor. And I hope, if there's any emerging leaders in this call, these are again some of qualities that we think are very, very important. So these are our contact information if you ever want to contact us about any slides or any content that we talked about today.
So thank you very much for your presentations. They were wonderful. I have some questions for you, and I'm waiting for some questions from the audience if they want to do. But I have some that I've been thinking when we were speaking. Actually, one of the things that we usually think is about the Canadian system here in Portugal, because it has several similarities to our system, but actually we always think that it's working pretty much better than ours. So we don't know how it is truly, but we usually think about it. And you were saying that you are suffering from the same problems that we have. So this, as you were saying, the shortage is kind of global. Some countries still don't have it because they are in a different phase of evolution about the health systems and about the sometimes about the rights. And when we were speaking, I was thinking, well, we, we had the Great Resignation. We had a lot of people getting out of our health and working in another thing. And Taylor said something that she thinks, or that you think that may help you in Canada. You were saying that having doctors to have licenses to work on other provinces, it may be helpful. But then I looked to Kim, and Kim said that some of the nurses, some of the medical staff are moving to other states and working, and they stop to have to let us have some confidence about the work the workers that we will have for our daily work. And I would like you to kind of think a little bit and tell us what do you think. What do you think it may happen that you may lose some of those you have if you open that? Just asking because you may give them
Great
more
question.
freedom, and you may be, if you give them that kind of freedom, they will be more happy. They may be feel that they are being appreciated with their needs, but you have the other side.
Yeah,
So
for sure.
you may have a problem. At least I'm saying this now. I will share why. In
Yeah.
Portugal, you don't need. You have licensure that at this moment allows you to go to the European Union. So we have a lot of people that are getting out of Portugal because they can, because they did the degree here and they are appreciated out of here and they receive more than they receive here. And most of the time they need to work a little bit less. So they kind of go.
Yeah.
So what do you think about this? How do you, may you have this problem or not? After you answer, I have another question about Canada, and I will ask you, King, to talk a little bit, which is about task shifting and task shift. But after you answer to
Yeah.
the
So I think totally reasonable. That could just create a different problem. And sometimes we have high hopes about small things, and then it turns out, oh, that's like something that we didn't. The knock-on effect is there. I think in Canada, the thing that will help is despite the fact that the United States pays more, we don't see a ton of brain drain going to the States. More, I would expect that actually, but we don't see a ton of that, at least in the world that I work in. But I think where there is room to gain with regards to pan-Canadian licensure is Canada is so vast. It is the second largest landmass. It is sparse. There's only like 40 million people here. Like it's huge. We have a lot of problems in equity, like huge problems in equity. Northern Ontario, like there's no physicians, like there's none. It's really it's so sparse that that's a problem. And so I think that the first problem of tackling the kind of fictional inter-Canadian borders will help us improve that level of equity. And I do think Canada as a whole, as a nation, as the identity that we have, does have the benefits that come with being a publicly provided service and an employee therein. I think we will have the ability to preserve at least within the country as we do today. And so the margin for gain really is in that equity piece. I also think, so Keen mentioned virtual care, and that really is something we're seeing a lot. So the really, really specialized experts, your psychiatry folks, for example, who really hone in on certain issues. Right now, they can't help somebody in two provinces away, but we could do that if they were allowed to do that. And I think this is sort of a little bit of a bureaucratic exercise that will see some net gain, despite the fact that people might want to go live in BC where the weather's better, for example. So I hope it can change. I think, we're the pool of humans, like I said, is just is too small, and we really are going to have to think about scope and doing things differently in general.
And you were saying that maybe one of the benefits that you take from that is it's about telehealth. So you may use this pan censure in Canada to get more telehealth being used. Actually, in one of our sessions, we were speaking about the new health relations, health contract relations between the organization, our organizations, and our employees. So, and when we were speaking about it, we had some ideas about a new way of giving of delivering health, which is telehealth. That some of the doctors may do it from their house, so they don't need to go to the hospital. They can do it from home. They may be more efficient, and they may be more comfortable if they want. And then you'll have another thing that is the new ways of getting dealing with that movements that we were speaking before of employees, or not, they are not employees, they are self-employed. So they go and they work some shifts in several hospitals, and they kind of are owners of their time, and they only give the time they want to give. And this is kind of a new way of looking through the relationships between the employees and the employees. And this is something that we here in Portugal, we are starting to see. We have to try to introduce it in our NHS, for being honest, because as Taylor was saying, the thing about negotiating, and that can may have a little, but maybe a little bit more lucky. I'm not sure totally, but a little bit more, which is the ability to negotiate about the wage the potential employer, with something that can increase value to our organization, and that may have talent, the necessary talent that you want. Actually, we cannot do that here. We have the same problems as Taylor. It's kind of in a way administrative fixed, and we have to stick to it. We cannot have a better wage for someone that we know that will increase a lot of value to our organization. It's kind of a challenge for us to try to deal with it. But then, as I was saying, we're still a little behind, I think, in terms of the evolution of the how can I say, of the tasks that each healthcare professional has. Someday I spoke a little with Bella about task shifting and task sharing, and she was saying about the pharmacist. That is an excellent way of getting people to what they need. So and release most of the hospitals, maybe some primary care from some situations that they don't need to treat. So how what is your experience in terms of test shifting and test sharing in your countries? What do you know about it? How to lead this? How did you get, and this thing is something about leadership, how did you get to some of the professionals to allow to share their tasks with another profession? How have you done it? So Kim, Taylor, be my guest to explain this.
You can start, Taylor.
Okay. So, I mentioned earlier of our kind of culture at our hospital of kudos and thanking people and celebrating the things that they've done that are good. I think there's kind of two benefits to that. One is morale amongst staff, makes you happy to hear that you've done a good job, makes you happy to feel recognized. The second part of that, I think, advances your ability to collaborate with others because it removes the kind of ego from I've done this, and that you're being recognized and people are proud of you, and you're more sort of, I think, supportive of collaborating with other people and helping them achieve and lifting other people up. And so I think it's a little bit about culture. And we also are a hospital that subscribes to lean hospital management as well. And so there is also this embedded subculture of if you see a problem, let's get together, let's rally, a team around this and let's fix it. And so I think when it comes to things like scope of practice, yes, the college decides that. And yes, we have regulations around that. But I think there is a willingness among people to do something for the greater good, to make it easier, to leverage our electronic health record. If we, maybe it can do more than we're using it for, as an example. And maybe we need to compare our workflows in order to arrive at, like I'm doing this and you're doing this, and that doesn't make any sense. And could we actually get the computer to do that? And then you do this and I'll do this. And from there, I think when you generate a frontline driven idea, you as a leader then can go and talk to the union and demonstrate that you've engaged the front line. And those are the types of things that unions like, that you're hearing from your stakeholders, that you're taking their feelings in mind, that you're still operating within the box that is regulation. But I think there is some wiggle room in that. And I think it really just takes leadership to facilitate those conversations and to bring people together and make it so that it's a safe place that you can talk about what you do and what you actually probably don't need to spend your time doing on. If you feel comfortable with yourself and with, in your skill set and the relationship you have with your manager is a safe place to do that, then I think we're able to do that.
Yeah, it ties back to what Taylor was saying earlier when we were talking about qualities, for one to be a great leader, relationships. I think relationships, you know, sometimes is really one of the most important factors whether your project is successful or not. So at least in North America, United States, relationships are super important when you're talking about motivating a team, aligning goals, addressing problems. So it's very similar to Taylor in that our culture is also like that. But I think it's also part, removing silos. I think especially in healthcare, removing silos is very important. And we have them in organizations, we have them in other organizations, but removing silos is another aspect to improve collaboration, improve communication. In terms of scope of practice, we're similar in that instead of pharmacy, it's for us, Taylor, it's really physician assistants. So for physician assistants, giving them a larger scope of practice, it's something that's being talked about. There's some legislation that's being passed. We have a National Physician Assistant Day for advocating for increasing scope. I actually have a brother who's graduating from PA school pretty soon, and we'll see how the future will work out in terms of scope of change. But yeah, a lot of it's also determined by our federal and state guidelines when it comes to scope of work. So really, again, when you talk about leadership and about people, maintaining those relationships is very important, and obviously operating within those limits. But for what I'd say, just the importance of relationships and removing silos in your organization.
I had a great boss once that told me everything's negotiable. Everything. If you think about it, it's not about whatever the current state is. It's about your ability to talk about it in a way that is, human and safe and invites good feedback and about being reasonable. Everything's negotiable.
That's an interesting quote. That one someone that another that you were saying that they kind of focus on the greater good. They kind of seem that they have a sense of purpose. So a sense of purpose that it is truly common, I think, or should be in the health sector. So we don't in some way that we are kind of having our lives dedicated to help others. So how to use this to lead. I was to lead. I was thinking. You were saying you had on the surface it was the servant leadership. That is kind of different, kind of new. Um, and we are always thinking on leadership, how to lead, who is the better leader. Actually, I'm always thinking it's the one that leads in the time they need to lead. So it's kind of a situational leader, and most of the times, if you can identify the correct leader, you will have better results. I would like to know for you what it is I may not say that perfect leader, but a good leader, the person that makes all the difference. Uh, I think that you were saying that is someone that is very good in relationships. But more than that, what do you think? Do you feel that you are good leaders?
That's a good question. So I think for me personally, healthcare leadership is interesting. It's unique because we are caring for a team of caregivers who care for patients. A lot of, sometimes it's even life or death. So it's unique in that sense that we are taking care of people who are most vulnerable, most sick. I'm not saying that non-healthcare leadership is, any less, but I think it's very unique. But the way I look at it is that I learned a lot from mentors. I learned a lot from preceptors. I learned a lot from people that I work with. And I think leadership is not so much about you, but it's more so about the team. So it's not me teaching a team. Sometimes it's the team about teaching me. So I don't look at it as a tiered system. I look at it as we're equals. You learn from me, but I also learn from you. But interestingly, I had one of my mentors tell me that you learn also a lot from bad managers. You learn a lot from bad leaders. As much as you learn from good leaders, you also learn what not to do from bad leaders. And so, yeah, in addition to relationships, I think learning from both good and bad leaders can help you become a better leader. Um, I think I'm a good leader, but I want my team to speak, but we also allow our team members to rate their leaders. And fostering open communication, being transparent, addressing, issues as they come up. For me personally, I think those are qualities I think, in addition to relationships, will, really makes one a good leader.
I think Kane's a great leader too. I think maybe I'll add to that and I kind of described this when I'm mentoring new managers and so forth on my team. When you're thinking about your role, it's really easy to kind of assume that you have to know everything and that you have to be the boss of everybody. But in fact, no one could possibly know everything. Will start there, and that's not very effective. So I think a good leader can see the potential in others and can figure out how to facilitate success in other people. So facilitation is an interesting skill and something that I think, is great to get trained in, because really this is about taking a group of people and seeing what the dynamic of that group is and how are you going to help all the individual members of that group sort of steer in a certain direction and empower themselves. So I think good leaders, really, the goal is to work yourself out of the job, because you being there in perpetuity is unrealistic. So your goal really should be, how do I empower people, and lift them up and help them figure themselves out so that this system no longer needs me and I can move on and whatnot. I think also a good leader creates other leaders. And so, there's a bit of a social responsibility, and it's easy in a caring environment. You already care about people, you're already here for that reason, is to kind of see potential in others and, and foster that and help them get to where, because somebody along the way lifted you up. Right. And so I do some mentoring, particularly, to other women. And we just had International Women's Day recently. And something I always say to young female leaders is, they're conventionally in every business, there's a glass ceiling. And yet you've sort of been able to come and break through it, and here you are in a substantial position. So, like, what are you doing to send the elevator back down? So, always thinking about what is it about your role that you're in reflecting on the privileges that you've had and the steps that the people who have taken you to where you are. What are you doing to reach back down? What are you doing to empower others? So, I think that's another quality I would list.
Thank you. I was listening and I was thinking about two things. One was that sometimes I think that a good leader is kind of evaluated as the number of leaders, in fact, that you have the opportunity to create. So how do you influence the life of the people that you have with you? So will they follow some of your steps? Will they try to get where you are? If they are trying to do it, you are doing something good.
Mm.
So, and another thing, it's something a quote that I do like. There is about leadership too. It is when someone tells you, or some hypothetical leader tells you that he doesn't have resources because he's not truly resourceful.
Mm.
So we always have some ideas, some way of thinking about our challenges and try to improve our work. And that may be using lean strategies, that may be using creativity. Sometimes it is. But after all, in the end of the day, it's people. So it's with our people. And so most of the times I was saying before, I have one of my boys, he is always creating something. He's always turning to new ideas. And the best is that he feels comfortable to show me, because usually I tell him, great idea. I'm not sure that we can use it, but I tell you, we will try. So I wanted to thank you. We passed an hour. We focused on an hour. We had between 1 hour and an hour and a half. I'm just looking. I think we don't have any new question. I would just like to thank you. It was an honor for me to have the presentation, to listen to you, learn a little bit more with you, and to have this final conversation with you, where we share a little bit about us as someone that has to lead. Leaders, maybe our collaborators, our employees may say what they think about it, but I do think about you too, that you are great leaders. It was an honor for me to have you here and to share some moments with you here and in the World Hospital Congress that we will have in Lisbon, and I'm sure that I will be able to share with you. Thank you both.
Thank you. Thank you for having us.
Thank you so much for having us. Great to chat, and I hope to meet, like, many of you in Lisbon.
Yeah, for sure. Thank you.
Thank you.